What young adults with disabilities have to say about healthcare transition and medical self-advocacy, in their own words.
Advocacy is hard. It's going to put you in some uncomfortable situations. It's going to make certain conversations with friends, with family, uncomfortable, flat out. You're going to have to juggle a lot of things. But at the end of the day, if you don't advocate for yourself, how do you expect anyone to know what you need? No one can read your mind. No one knows what you need. No one knows how you're feeling deep in your soul.
I think it was hard to learn to speak up for myself because I always had my mom advocating for me and speaking up for me. So I think at first, learning that I had to speak for myself, and if I wasn't okay with a treatment plan or something, that I had to say, I'm not okay with this. Let's come up with something else.
Before anyone can advocate for me, I have to advocate for myself. I have to reach out and ask for help so people can advocate for me.
You know, every time I go to a doctor is a chance to improve my health and learn something more and seek better treatment. And so going in with a list of questions, a list of concerns, even writing them on my phone, has been really helpful.
To be an adult, you have to take care of what you need. And, it's really self-care. Self-care is not all about bubble baths and face masks and doing what you want. It's about doing those hard things in life that you need to survive and you need to keep you healthy and alive and well. As unfun as it might seem, as unfun as it is, dealing with insurance and taking charge of your healthcare and taking responsibility for your health is really a huge part of self-care.
I want everyone to learn and research and share about their disability.
It's a journey, and I think it's a lot to go into an appointment carrying the weight of all the symptoms and the disease and whatever it may be, plus trying to think clearly, and you're in a new environment and you don't know what's going to happen, and maybe you're anxious about a procedure they're going to order, things like that. And I think a lot of it is just letting us have our own journey and kind of giving us the space to advocate.
What young adults with disabilities have to say to parents and caregivers about healthcare transition and medical self-advocacy.
Independent does not mean they do everything on their own. Interdependent is okay. And then you build that network and you build that support group and that support system, they should be able to find a way to live on their own.
I would say let your child be as independent as they want to be. That was one of the hardest parts for, I think, my mom and I, was with some of my gained independence. She almost kind of felt like maybe her place was maybe she was no longer needed. And that could not be further from the truth. I need my mom. I love her. She's my mom. She's who I call when I'm like, how much bleach do I put in the washing machine? I don't remember.
Infantilization can lead to problematic results later in their life, because if that is prolonged, chances are that others will not see them as adults.
It's okay to be in the background, right? And to kind of do like I do. If I need help, I go to my parents. I'm like, hey, I don't understand this medication, or hey, what does this mean? And I have a conversation with them. But in many cases, I'm leading from the front.
Let it happen at our own pace, because we already struggle a lot with a disability and being behind. And, some of us have learning disabilities, and some of us are playing our whole lives to catch up to where the norm is, even though I hate that word because nobody's normal, but playing to where the norm is. So it may take a while, so just be patient. And I know that everyone says, oh, the goal is independence, but some people may need help their whole lives, and just accepting that is the first step.
Kids with disabilities can go to college. Don't worry as much about them. because I think like they can handle it, but I think they need more of them not doubting them and more like training or preparing them to go to college and be more independent. It might be more difficult, but it's just prepare them to, like just any other kid, just prepare them to leave. But that don't focus on what other people say too much of what their kids can do either. Like it's not their kid, it's your kid.
If you always speak up for them when they are on their own, it's going to be harder for them than if you try to have them come up with their own questions to ask the doctor and let them ask them.
I guess it's like important to teach them how to book appointments because, at least for me, when I was scheduling appointments, it was annoying as heck to just schedule them.
My mom made sure I always knew exactly what medicines I was taking, and I knew who my doctors were. When I was, 11 years old, I could spout off every medication I was on and every test I'd had and every treatment.
Included them in the process so they know how to do it.
Definitely be there for them and encourage them and guide them along the way so they know that they're not alone, and definitely encourage them that they have a voice and if they can use it to speak up for themselves.